Okay, welcome to the ninth edition of Achieving Your Optimal Health. It's amazing to think that we are closing in on 3 months now with these webinars. And when you look at the the subjects that we've covered, can you guys see the screen okay?
Yes.
Okay, excellent. So we've got an amazing library of subjects now, and each of these have their own video. And for example, last week, Sherry Martin, you click on this link here, and it's going to take you to her webinar. And here you see affording medical care along the way to achieving your health goals. And then click here and you can hear her webinar. You can see her webinar PowerPoint slides and her webinar notes following these slides. And this is true of all our webinars. And so we'll have this after tonight's webinar with Denise. Once again, to access this page, you go to LasVegasAreaTrails.com, click on Health Education, and then here you are at our webinar series, and you can always register for the upcoming webinar right here. We thank Social Register for sponsoring this webinar series. And so the whole point of this series is twofold. We're gaining knowledge from the professionals in the area of our health and improving our health. And also we're operating as a support group here. And it's a group where you can ask a question, you can set goals for your health. Where do you want to be in a few months from now? Set a goal, set a target date, and then ask the professionals questions to that come up as you're working toward your goal, because working toward a goal is never a straight line. There are obstacles that come up. Our body reacts in various ways. We say, my goal is to lose a certain amount of weight, or my goal is to run a marathon. Well, I can guarantee you that on the way to the goal you set, there's going to be physical issues that come up. There are going to be, emotional, motivational issues that come up. There are going to be information issues that come up. And that's why we have this support team. So in a bit, we'll after our webinar for the day, after our presentation for the day, we'll have an opportunity to track the goals we've discussed. And so speaking of the presentation for the day, I'm going to just click on Denise Tropea's presentation here. This is the blog page where her video is going to show up following her presentation, probably within 24 hours. And just want to say that by way of introducing Denise, definitely she's got a doctorate, doctor of podiatric
medicine.
Yeah, DPM. And so she has studied this deeply, and also she has experience maintaining her private practice in Las Vegas for 25 years. Denise recently decided, what I'd like to do is move toward more of a natural health approach. And so she's making a massive transition toward natural health, and maybe she'll tell us a little bit about that, why she's doing it. And but it's very exciting. And so today Denise is going to present on alternative ways to deal with chronic pain. If you're an athlete, you need to you're going to face chronic pain. If you have experienced an accident, or you engaged in activity that's a little outside your norm, you may experience chronic pain. And so there are a number of issues with, that cause us to experience chronic pain. And so Denise is going to help us with the approach, because as you know, when you're in pain, it changes your whole outlook on life. It affects your sleep. It affects every area of your life, your mental outlook. It affects your relationships if you're in this chronic pain. So Denise is going to help us with this. And so now, without any further ado, I'm going to turn this over to Denise Tropea.
Good evening, everyone. I'm Dr. Denise Tropea, and tonight I'm going to discuss chronic pain. I've been a podiatrist, lower extremity specialist for over 30 years now, and had a private practice here for 25 years. Over the years, I've seen my share of pain, whether it be pain in the foot, whether it's endemic to the foot, ankle, lower leg, or it goes higher. So when people experience chronic pain, you have to be a little bit of a detective to determine really where is it coming from, the pain, or if they've already had documented pain, how it's impacting other parts of their body. Next slide. So definition of chronic pain and some statistics is pain that lasts more than 12 weeks, which can be due to some illness or injury. So pain that is lingering is a lot different than just acute pain that may last less than a couple of weeks or so, or maybe a month, that has a chance of resolving itself due to different treatment modalities, whether it's rest, physical therapy, medication. But when pain does last more than these many weeks, it is considered chronic. Number one cause of long-term disability in the United States. And 1/3 of people suffer from low back pain, and over 50 million, it's hidden there, is spent, 50 billion healthcare dollars are spent on treatment alone on people that suffer from low back pain, followed by migraine, headaches, shoulder, and neck pain. So we see that there's a lot of possible overuse problems. Next slide. You can go to, next. There we go. Types of chronic pain is also important. The nature of the pain that the person is experiencing. A neuropathic pain is a burning, stabbing, lacerating, sharp pain, which can be due to mechanical problems, such as low back pain that may be due to impingement of nerves, or carpal tunnel syndrome due to impingement leading to numbness or pain in the hands, much like pain in the feet can be a radiating type pain due to impingement of the nerves in the low spine. Systemic problems can also cause neuropathic pain. The number one cause is diabetes. Diabetes can cause neuropathy, nerve pain, burning, stabbing pain that prevents people from functioning daily because of this pain that is more predominant in their feet. And this is due to uncontrolled blood sugar or possibly being recently diagnosed with diabetes. So nerve pain can have a neuropathic component. Somatic pain is skin and muscle pain, such as someone that has a chronic fatigue syndrome, someone that has fibromyalgia, in which there is pain in the muscles themselves, causing them to have heaviness in their body and achiness to where they don't want to do much of anything. Visceral pain is pain in the trunk of the body, and with pain in the trunk of the body, it could be limited to an organ system, such as the gallbladder, such as the liver, the stomach itself or intestines. And a lot of somatic pain can also be referred pain and also manifests itself in other areas of the body, such as the shoulders and the low back. Nociceptive pain is sensory nerve pain, and that's due to when you have a crushing injury, a cut, some type of trauma causing you to have pain and needing to have some sort of medical attention to get this to heal. But numerous times, if people have burns on their body, it may be lasting pain that may result due to those nerves, those superficial nerves that are on the skin that never heal properly and could lead to long-lasting disability. Then psychogenic pain, headache, stomach pain, due to mental or emotional issues. And people will go to the doctor and get testing done, and really nothing comes of it. And that's when you have to go a little deeper, probably to find root cause. Probably things like what Loya spoke about a couple of weeks ago with traumas from childhood leading to these emotional issues that we've carried through our lives. Or it could be due to even our diet, with stomach pain, things that even Dr. Carlson talked about, in which the pain is due to the different foods that we're eating. And when we go to the doctor and they say, well, no, there's nothing wrong, it must be all in your head, but you still have some pain there. So it is real. There is some sort of discomfort there. Next slide. So some diagnostic tests that can be done in order to further confirm what they believe it might be. If someone has low back pain, if someone has leg pain, neck pain, these are some testing that can be done. X-rays, radiographs, detects bone abnormalities, arthritis, malalignment, bone density issues. Osteoporosis, which is low bone density, really is not painful unless it causes fractures. When people get pathological fractures in their spine, it can be very, very painful, and we can actually detect that by either x-rays or even a CT scan. MRIs examines the bones, the discs. Are the discs herniated? Are they slipped? Are they out of alignment? Also the spinal cord, is there impingement on the spinal cord? Soft tissues, inflammation. Inflammation can be seen on an MRI, especially if it's in the bone or in various connective tissue. CT scan is a accumulation of x-rays that are taken in order to see subtle bone fractures. You could have certain stress fractures, whether it be in the leg or the foot or the back, and these bone fractures are not coming up on traditional radiographs. And so by doing a CT scan, you can actually see if there are certain fractures that are there that need to be addressed. And the person's pain is not just, in their head. EMG, electromyography, and that tests the electrical activity of muscles. This is for diagnosis of weakness in certain neuromuscular diseases. And then we have nerve conduction studies that detects nerve damage, impingement, and as I said before, certain systemic diseases such as diabetes can actually start damaging the nerves. And when the nerves are damaged by the uncontrolled blood sugars that are roaming around in the body, that leads to the neuropathy. Also, carpal tunnel syndrome can also be diagnosed by a nerve conduction study in which we see a slowing of the nerve conduction leading to damage and pain in the person's hands. Next.
Okay. Okay.
So when we talk about conventional, versus alternative treatments, I see my slide got a little messed up here, but that's okay. We can figure that out. Conventional treatments, being nerve blocks, Nerve blocks and epidural injections have really taken off over the years. Whether they're very helpful, I think the jury is out. But still, nerve blocks can be helpful in maybe reducing and stopping that overall pain cycle. But they can't be overused. That's the problem. They cannot be overused, and you have to have, are they going to work or not? Then you have medications such as anti-inflammatory medications such as Motrin, Advil, ibuprofen, and these can have detrimental effects on your GI system, your kidneys if you're not careful, and you cannot take them for long periods of time. They're good in the initial, but you cannot be dependent on them, which a fair amount of people are, and they're seeing where problems lie. Opioids, yes, that helps to mask the pain. It's narcotic, and I will be discussing a little bit more on opioids later. Physical therapy can be very helpful. It could get down inflammation. There's certain modalities such as ultrasound, electrical stimulation, different types of TENS units, things to really help break the pain cycle. And then, of course, with surgery, that's if things are really spelled out as you have an impingement, you have a herniated disc, you need some sort of a surgical procedure. I always recommend people get numerous opinions and know whether they need to go to an orthopedic doctor or a neurosurgeon. But we're going to concentrate a little bit more with the alternative being chiropractic treatment. Try and put the body back into balance. By various modalities that chiropractors do, whether they do manipulation, whether they're doing some sort of fascial release of the muscles and relaxing the muscles around the spine, because if the muscles are real tight, everything is tightening up, and that's where the pain is originating. Diet and supplementation can help people if they have a lot of inflammation and arthritis to reduce that amount of inflammation in their body, and that could be helpful to a degree. And also diet in the fact that if they need to have weight management, possibly due to take some stress off, whether it be the feet or the knees or their low back, then definitely weight loss is necessity. Acupuncture been around thousands and thousands of years. What it is doing is helping the body heal itself by utilizing small needles in the acupressure points of the body along the energy lines, the meridians. What it's doing is you're releasing endorphins. You're releasing the natural pain mechanisms that we have in our brain to help the body heal. So acupuncture has been very beneficial, especially for people with chronic pain syndromes, headaches, sciatica, which is nerve impingement of the sciatic nerve in the low back that can go all the way down to the heel of the foot. So acupuncture has been a very popular modality over the years. Some insurance companies are covering that now, so I guess that's a plus in the right direction. And then exercise programs such as yoga, such as stretching, and then modification of certain activities that you're doing. Maybe the fact that you've been lifting things for many, many years and realize that you really need to either not do that anymore, modify it some way, or just not be in that field of work. And then also we're going to talk about CBD and where the place is for chronic pain. Next. Now I'm going to talk a little bit about the opioid crisis. Since in the late 1990s, there was just a widespread misuse of these medications. So I wanted to just fill that in by saying that with chronic pain and the advent of people coming in, oh, my back hurts, oh, my neck hurts, my shoulders, etc., doctors were saying, okay, here, take this. We won't keep you on anti-inflammatories for long periods of time because we know the problems with the stomach and the kidneys, but let's do some narcotics. And the perfect storm did occur during this time. This is the time when I was in private practice, and it was a misinterpretation by pharmaceutical companies on different medications that have come out, different narcotics, in which the drug reps would come in with these samples and saying, oh, these are much better, they're going to give them more long-lasting relief, they're not addictive. So these are all things that they were telling the healthcare professional, thinking that, well, I might as well, prescribe it. I can, get some free samples. I can get the patient on it. We have some vouchers for some coupons. So it was like, okay, here you go. And then weak regulation. The DEA was not as stringent like they are now, and there was a lot of people that were going to different doctors, patients going to different doctors, and then getting a lot of different prescriptions. So they were actually, drug seekers. And I had my fair share of them. People coming in and asking for, not in so many words, some of them would be a little sly about it, but asking for, prescriptions of narcotics, and wanting to make sure that they had off a certain amount of time because their back was bothering them and they needed a certain amount of narcotics to get them through. And it was becoming very difficult to really realize, where does this all going to end? So it was overprescribing. And over time, we would then have the different pharmacies that would connect with each other, and we would be seeing that we would be prescribing to patients, and so would another doctor. They just got 80 from one doctor and 100 from another doctor. I mean, it was really getting out of hand, the opioid prescribing. Next. So the current situation, as we fast forward, that the DEA is now enforcing guidelines on limiting prescribing by doctors. So a vast majority of chronic pain patients have to be seen by pain management doctors, such as anesthesiologists that also do injections. And they have to sign contracts with them to control how much medication they receive monthly. So the majority of people are having to reduce the amount of opioid they're accustomed to taking. This is leading them to have withdrawal symptoms and increased pain. Because you can have people that have been on narcotics for over 20 years, and they've just been on them, and then all of a sudden, bam, they're reduced. So it does lead to a problem. You can go back to that slide again, please. So just to add where we fit in now that I do surgery on a patient and I need to prescribe them with narcotics for their pain, we have to go through all this paperwork. We have to document exactly how many they're going to take for how many days, and they cannot go a day earlier to get their medication. And if the medication is not working right, well, then we have to wait a couple of days. So it's really become a very difficult situation when you're trying to treat someone from a pain management postoperative standpoint. Next. So when I talk about patients coming in and having these withdrawals, not getting enough of their pain medication that they're used to, this was happening to my patients that I would see for their foot issues, not necessarily their chronic pain, back pain issues, but they would be coming in and really looking like very strung out. Their blood sugars were not in good control. They were not doing well. And, you talk with them and they said it's because of they're just not getting enough of their narcotic and that they've been used to for so long. So this got me interested in the the CBD oil, cannabidiol, in which it's a non-psychoactive part of the marijuana plant. It comes from the hemp plant, and it does not produce a high like marijuana, and it has little to no THC. Next. So, but why does CBD work so well? Because it works on our endocannabinoid system. It's a system that was discovered in 1973, and it's a opioid receptors that are actually in our brain. These receptors are present in all our cells, and it regulates our sleep, mood, pain, inflammation. It keeps our body in this balance, so to speak, in this flow. And then in 1988, a government study by St. Louis University School of Medicine demonstrated that we have receptor sites that respond to cannabis. So this is a very, very interesting situation in which when I went to medical school, podiatric medical school, they did not teach the endocannabinoid system. Well, it was just discovered right around that time. But as time went on, they were still not teaching it. Nowadays, there is a handful of medical schools, so they are getting on board, teaching about the system. Next. So when we go as far as, say, with the endocannabinoid system, we've also been looking at what endocannabinoid deficiency can do. And endocannabinoid deficiency has been linked to different conditions, such as fibromyalgia, migraines, irritable bowel. And so by having this deficiency in our own a pain relieving mechanism, as we call it, or homeostasis mechanism that keeps us in balance, we are getting problems with chronic pain. And a deficiency can develop due to diets dependent on sugar, carbohydrates, grains, processed foods. So here we go back to where we've talked about before, how our diet plays such a big part of how our body actually works. So nutrition is definitely the basis of a lot of different chronic conditions that we do see. Next. So tips when evaluating certain CBD products: third-party testing, in which results should be available on their website, the purity of the product, consumer reviews on their effectiveness, and then speaking with your doctor before using CBD. Putting that out there. A lot of doctors are in tune to CBD, and depending on what their knowledge is. So it's important to speak with them. What I do see is in the future, this is a billion dollar industry. It is just exploding now. In fact, I've read that certain colleges now, you could go to school and learn more about CBD.
I will.
And it's and how people are going to be trained properly, because right now there really are sporadic protocols. How much do I take? How much is going to work on me? Which products are good? Which aren't? Should I go with an oil versus an edible? But I think over time now we're going to see more standardization, more protocols, and people getting the proper information that they need in order to help with their various conditions. Next. So in conclusion, dealing with chronic pain can have an impact on all the 5 pillars of our health. When we look at the physical, well, that's where our pain is manifesting, and the longer the pain is manifesting in one area, it can spread. If you have low back pain, leg pain, it can make its way all the way down to the foot, because it likes to travel. And then also the mental issue of not feeling like yourself, not wanting to do the things that you normally would do because you're focused on, I have pain and this is the way my life is now. And then the emotional of exhibiting depression and anxiety from having chronic pain for a long period of time. And then the social issues of not wanting to do the things that you once enjoyed, not wanting to be around people because you just don't feel good. And then the spiritual can go both ways, in a sense, where you can say, oh, why me, and really turn off that source of faith that you have. Or it may turn your source of faith on to say, maybe this is something that I have to look at. What is this teaching me? What things can I do to help myself and help the people around me to deal with this chronic pain in a better way? So support from family and communities can also help people cope with this and hopefully result in some sort of, successful, treatment. And treatment may be a multitude of a lot of the different things that I discussed, or maybe there may be different modalities that people can utilize that can help them. And my last slide is how people can get in touch with me through either emailing me or my cell phone. Thank you.
Thank you so much, Denise. I'd like to open this up for questions. And what I encourage each person here to think about is, where have you experienced pain that is chronic, the pain that you can't get rid of? Have you experienced this in your life? How did you deal with it? And then maybe Denise can jump in and respond to your situation and just give some insight. So who would like to go?
I can talk about chronic pain.
Okay.
I mean, that's what started my 18-month journey to become involved in the health sphere. So after 6 years of doing boot camp, right? So I'm being an amateur athlete. My shoulder got to a point where it was unusable. I couldn't put load, couldn't do push-ups, couldn't do pull-ups because of the pain. And so my first go-to solution was, hey, lay off of it for 2 months and then, let it calm down and heal itself and then get back to it. But that didn't help. I found myself in the same spot afterwards. Wow. So it wasn't an easy issue to deal with, and I had to work with professionals who had a much better understanding of the body than I did in order to get it addressed. I mean, it took more than 18 months to actually get to where I was back to able to use it. So, I'm a fan of anything natural and non-invasive in terms of as a solution for pain. So I like the idea of being able to use a plant source, a plant compound to help address that as an issue.
So Guss, what did you use when you were dealing with this pain? You said it persisted. You laid off, and then you came back, and the pain was still there. Did you utilize any prescriptions or supplements to deal with the pain? What did you do?
I was very motivated to get it addressed. I'm not a fan of pharmaceuticals, right? So I did a year of massage therapy. I did 10 chiropractic sessions. I went to my and when that didn't work, I went to my primary, who sent me to an orthopedic, who sent me to physical therapy, and I did that for 3 months. But when that didn't work, I went back to my orthopedic, and I was recommended surgery. I was given that as an option. Fortunately, I found a solution that didn't require surgery, but I was pretty desperate. I was running out of options, and CBD wasn't on the landscape as it is now as a solution, but I would have definitely tried it had it been out by then.
Okay. And so you found a solution through the structural body therapies?
Yes, yes. So I found a company called Structural Body Therapies in Ogden, Utah, that their understanding of the body incorporates fascial tissue, which is a special connective tissue that surrounds each muscle fiber. Uh, and they were able to use that understanding to help get me out of that situation. All right. So I was very grateful for that. And that's what got me involved with my clinic here. But right, I was fortunate, and I was in a space where I could get, I could get out of that situation. That's not an option for everyone, right? There are we have clients that are older, that have had multiple surgeries, that are dealing with nervous issues from the nervous system, where we can take them a certain distance and relieve a certain amount of pain, but then they need help getting further, right? They'll be very honest with us and say, "Hey, I love coming here. You helped me a lot, but I still feel something that's still painful." And, we've been thinking more and more about, okay, at this point, we've gone as far as we can. What other solutions are there to get them further? Or at least to say, hey, okay, you're in a space where you're going to be dealing with this for your situation for a while. Hey, what natural options do you have? And I think CBD fills that void, where they're staying away from more opioids and pharmaceuticals, but they have a natural solution with no side effect. I mean, that's a no-brainer for me.
Okay. Who else has a pain story? Thank you, Guss.
I do. And I have a story similar to Guss. I came back from deployment with some injuries, had surgery within 6 months. I had surgery on my knee. They started the documentation while I was deployed in Kuwait, from my time bouncing back and forth from Iraq. So I came home and they started the paper trail for the surgery on my knee. My knees were really damaged. My ankles were damaged, and that was 2016. I had the surgery 2017, and then earlier this year, found out I have some spinal, C5, C6, and then lumbar. And I started taking CBD right when I came back for the chronic pain, because they wanted to give me all of these really high dose pharmaceuticals, and that's not who I am, which that's the beginning of the story of how I came to be attracted to the work that I do, was because of the experiences that I walked through coming home from deployment. So I take CBD. I take 4,000 milligrams, like a couple drops of a 4,000 milligram bottle, and I treat it like a vitamin, and I'm fine. If I skip 3 days, if you treat it like a vitamin, you can handle higher thresholds of pain than if you treat it like if you have an immediate need for it. If you do small doses like you would vitamin D or vitamin C, it's much more effective. And so I'm really glad to see CBD getting some attention in this webinar, because it's really good for chronic pain. If I skip 3 days, if I run out of supply for 3 days, I'll feel that full body arthritis kick back in. And I'm on, I take the generic for, I think, celecoxib, and I'm at the highest dose I can get. So I can't, unless I change medications, I can't go any higher. And CBD picks up the rest of it to protect my organs. So anything more on the pharmaceutical side, I would be damaging my body. And CBD is the supplemental piece, along with alpha stem. So those three together, and I can manage my chronic pain. But if I take any one of those away, I'm basically paralyzed with pain.
Wow. So, okay. So, Guss and Annie have both shared pain story. So Denise, how does this work? So a person is in pain. Do they need to go to a doctor to have this prescribed? And once it's prescribed, do you put a drop on your tongue, or, you know, how do you apply it? So how does it work?
Well, the thing is it's legal, you know, in this state. So there are quite a few companies out there. I utilize a company as well, and I would get them started. Would probably do the oil, and there is a certain guidelines of how many drops that they can start with, and just kind of work up to when they start to feel, you know, some relief. So it's different, you know, for everyone. So it is a good idea for them to start with the oil, and have a consultation with them and see where they're at. Give them about a week or two that they're taking the product and how they're feeling. Also, I've had some people that have not done that great with the oil, have gone on the edibles, and that's been more effective for them. So, you know, really, it just depends. There is a little bit of a learning curve, and I think as time goes on, with people becoming more certified and having more knowledge with the industry, I think it's going to become more of a mainstream in which we're really going to know how to treat how to treat certain things with the CBD.
Okay, so the question is, how does a person get CBD? Do they just go on to Amazon.com and order?
No, they want to look at different product lines.
Okay.
Product lines that are third-party testing, some of the top products that are out there, purity of the product, ones that have the most purest oil that you can and not have other fillers in them. So they want to look at the ingredients that is in there and the purity of it, of the oil.
So where are they looking, actually? Are they at a store? Are they?
They can go to a store, yes. They can go to a store. They can go to a store, or they can, I mean, people get in touch with me if you'd like, and I can you know, direct them towards ones that I have utilized as well. But yeah, you could go to the store and you can really look at the purity of the product, the third-party testing, to see the, you know, exactly what they're harvesting and where it's coming from, that sort of thing.
So this is an over-the-counter.
Yeah, it's over the counter, yes. But once again, there's a lot of products out there. Just like there are a lot of vitamins out there.
Right.
You really have to do a little bit of research and get the purity of it. They even, you know, they sell it in sprouts too. But you really need to get the purity of the product. The pure products are usually work, you know, the best there. So it is important, or people can then speak with their doctors, because their doctors may also have a brand that they're using and they're happy with. Maybe even naturopathic doctors can also help as well with Dr. Carlson. Myself, I deal with a certain company as well. So, you know, we have to go with where we feel comfortable and reputable. To just go into a store like vitamin store may not be the best way to go. It might be better to go into actual, you know, the CBD store and look at some different quality products there.
Okay, so
Can I do a little plug?
Oh, go ahead.
Oh, go ahead.
So one of the companies that I consult for is Shah CBD, and they're a saffron CBD company that is organic. And the more I've studied organic, the more I see the benefits of organic versus non-organic CBD.
I didn't even know there was a difference. So there is.
Well, that's very important too, and that's where the purity comes in, and the third-party testing and all that. You know, that you have to be a little bit of a, you know, research. But just to go in a store and just to pick out, you know, something, you know, just do a little bit of a research on it.
Yeah, CBD is an entourage drug, so you always want to pair it with something. It needs a dance partner. So whether it's THC, for those that want the euphoric side of it, or saffron or something, it has to have a dance partner.
So you can't just buy a little bottle of CBD and put drops on your tongue and expect that that's going to work.
You can. It would just take more because it by itself is not very effective. It's like trying to dance by yourself. You can have fun dancing by yourself, but there's more fun when you have a partner. It's more effective when it's paired with something.
Interesting. Okay. Well, this tends to lead us to the need to talk to someone who has experience with CBD as opposed to just going over to Sprouts and getting.
Right. Well, I take it myself. I take it at night. I sleep better.
Mm-hmm.
I mean, I do it for inflammation. I see it in my joints. So for me, it works. And I do the THC free, which did take a little more time to work. Yes, but it does work. And also, we can give it to our pets as well. There's oil for the pets, or there's treats that they can take, and it does help them as well with their anxiety levels, hyperactivity.
Okay. Who else has a pain story? Okay. Well, I can say for myself that I do a lot of trail running, and I guess I put a lot of stress on myself, and I'm currently, for the first time in a couple of years, I used to have pains a lot when I was in my like 20s and 30s, but I haven't had pain for a few years. But I think one of my pairs of shoes is getting a little too old. I ran in the mountains about 10 hours last Saturday, and I do have a knee issue. So yeah, I'm experiencing some pain in my knee. My experience says, I need to get a new pair of shoes because my shoes are getting old, and that's usually my first response. But what do you suggest for athletes? I know that you can't just take stuff and keep doing whatever you're doing that's injuring yourself. That's like the asking for problems. But what do you do in a situation like that?
Can I answer that?
Go for it.
Or at least make a comment about that? And you bring up a valid concern, right? And that's a concern that we have here in the clinic. Our relationship with pain is, we see it as a communication device between the body and the mind. Your body gives you pain to let you know there's something off, there's something wrong, there's discomfort, there's something's not acting as it's supposed to be, right? And we want to have the awareness to listen to that, and then try to decipher and try to analyze and try to get, connect with experts to see why this pain is there, right? Is it because of something you ate? Is it because of a emotional trauma that you've encountered and it's resurfacing? Is it because of a physical issue, right? I feel that it's important to look at those, to look at the entire picture, right? The full spectrum, just like we deal with the pillars, right? To look at all possibilities is why this pain is occurring. And the reason being, we, especially the people on this group, we practice proactive health. Do everything you can to see why you're in pain and address, if possible, the issue, right? If it's your nutrition, change your nutrition, right? If it's you're feeling bad because, of the work environment, change it, right? If it's because of your posture, right, address it, right? Do everything you can to be proactive about your health. And then when you've reached the point where you have done everything possible and pain is still there, then it's time to make to have that understanding. Says, okay, I've done everything I can. This is what remains. Let me address this, preferably naturally, right? That's why I like CBD, right?
Mhm.
It's like there's I'm not familiar with any bad side effects that it has. To say, okay, I've done everything I can for this last amount of pain. Let me use this tool to help mitigate this and let me live a better quality of life.
Yeah,
Right?
and I've
The process you want to
experienced,
go through.
yeah, I've experienced different pains through my running, because I've been running for over 30 years. Well, actually, since I've been in high school, so it's even longer. I'm embarrassed almost to say, um,
Right,
but
and I like that you say different pains, right? So there's a sensitivity there, right? An awareness, right? There's good pain, right? Hey, I'm sore. Hey, my calves are on fire.
mm-hmm.
That's good communication, right? There's different types of pain, but you can tell when pain is bad, right?
Yes,
And
and
when you need help with that.
yeah, and I've experienced it due to shoes. I've experienced due to stress, where I'd go running and I'm under stress, and then all of a sudden I've got this lower back injury, and it's stress. I've experienced it due to what we call compensation injuries, where I've got maybe my left knee is in pain, and so I start running a different form to protect my left knee, and then pretty soon my right ankle is hurting, and so there are, and I've experienced it due to overdoing it. I get excited running in the mountains, and I go further and further and further each week, and then pretty soon, bang, I get stopped by pain. So there are a lot of, and then running form, um, and so the form of whatever you're doing. I know that like Loy has been doing a lot of moving and lifting and moving with heavy objects the past couple of weeks, and is in some pain, and um, so I think that how we move about influences our susceptibility to pain and the length of time for recovery. So it's just, I've got like 40 different things that I look at when I get in pain. And I hear what you're saying, Gus, that you go ahead and try those 40 things, but if that pain persists, then you've got an issue, and that's the time to see a professional who can help you with dealing with pain. I once was taking Motrin I was really young and stupid, and I was taking Motrin thinking, oh wow, I could run, and then the next day I can take Motrin, and then I can go run 20 miles the next day, and it doesn't bother me. And at one point, I actually burned a hole in my stomach and had to have surgery because of the effects of the Motrin. And I was taking that with Excedrin. I mean, it was just, I was like a stupid junkie at that point, but it was because I loved running. And so, I've experienced just about every combination of things you can do, stupid and accidental, to cause pain, and then how to get out of it. And so,
No,
yeah.
and we come across athletes that are in the same space where it's, hey, I'm going to hike. I'm going to do this trail run. I got my ibuprofen. I got my Advil. Right. That's their regimen. Right. That's their expectation. That's how they're handling this pain that they find themselves in. What I would like them to see is have some curiosity. Why are you feeling this pain? Right. When you're young, your body is very forgiving. When you're our age, you have to look at things more closely.
Yeah.
It's not an option to have, surgery because of, continuously taking Motrin, So So, you know, we like to see that curiosity as opposed to saying, hey, I'm in pain, pop a pill, move on.
Well, you know, even when you're young, you need to develop the habits that are going to take you through the rest of your life. And if you just have the attitude, well, you know, I'm young, I can do whatever I want, and I'll be fine the next day, that's all right. But you know, if you there's something in your diet, something in your form, something in, you know, whatever all those 40 issues are when I'm feeling pain, if you can fix that when you're young and get in touch with that and listen to your body, and do the healthy things to deal with it, then as you get older, that knowledge is going to be priceless.
You know,
That
it's
knowledge
also
is,
a cumulative effect. You know, it just like didn't happen, you know, yesterday. It takes many years for a lot of these things to manifest.
Oh my gosh.
You know, that's another thing too. When we're younger, we feel invincible, so we're doing all these things, and then as we get older, it becomes payback time, and we're finding that you know, arthritis in our knees or our spine or our ankle, you know, then it all comes, you know, maybe an injury then just lights everything up, and it's like, oh gosh, upset the apple cart here, you know, and then you wind up with an issue. And so that's another way to look at it also.
Well, that scares me because I have this vision of, you know, maybe I'll live for years with no pain and everything's going to be great, and I'll be 90 and I'll be out there running and climbing mountains, or maybe I'll have broken myself down so much that I'll be in a wheelchair. I don't know. I hope it's the first, but I hear what you're saying. It's really important, this cumulative effect.
yeah, the goal is, you know, 100 years, 100 years old, carrying 25-pound grocery bags in each hand.
Mm-hmm.
That's the goal,
Yes.
and that's what we got to prepare for and work towards.
Okay. Well, let's go ahead. Thank you so much. This is really important because I think pain is something that a lot of us deal with. Anyone, it's, you know, everyone at some point in their life is going to be dealing with pain. And okay, I've got the share here, and so let's just pop over real quick. And we got a little bit of a late start, but I want to keep us pretty much on time. Anyway, what's coming up next week is Guss on fascia. What role does it play in your physical health? And then we have Annie, who is going to be leading yourself on your personal health journey. And Joe Garcia on stem cell research and healing. Dr. Angela on what labs are essential. And then I'll be doing one. Incidentally, I've been thinking of this issue, as you can see by my title, Staying Power, the art of listening to your body. So that's very much in line with what you shared tonight, Denise, from another approach. So anyway,
David, I wanted to ask, do we have any time to do a Q&A with Denise regarding CBD?
oh, definitely. Go ahead. Go for it.
Okay, I have two. What's the difference between oils, right? So I'm guessing those are drops you put into you take orally, and and balms, right, that you put onto your body.
Denise, we got to unmute you.
With the oil, with the drops, you can go under your tongue and put so many drops and then let it absorb there, and don't eat anything for whatever, like about a half hour or so, or don't drink anything for about, you know, the same time. So that's where the oil comes in under sublingually. Or if you have the balms, then that's going to be incorporated in a cream, and you're going to put it on the affected area that hurts. So then topically, it's going to go in and absorb. Also, people have put some oil even on the area that hurts them as well, and that could be effective too. You just have to watch out for some skin sensitivity. But the balms is more like a topical, and that's going to go and be absorbed through the skin to the area, and then also the drops are under the tongue.
So is there a difference in effectiveness between the two?
Well, I would have to say with sublingually, you're going to get it more throughout the system. So it can definitely be more effective to go right to an area. What I've seen when I put it on topically, it works fairly quick, but it does wear off maybe after a few hours or so. So it's probably better to do the sublingual. That's going to last a lot longer.
Does
maybe
CBD
12 hours.
Does CBD heal pain or just mask it for a period of time?
Well, what it's doing by going with those receptors, it's helping to balance the body out. It's trying to get down the inflammation. It's helping with the sleep cycle, helping with the nerves themselves. So that's what it's doing. It's putting things back into balance. That's why I discussed a little on the endocannabinoid system, because it does help what we call homeostasis, which is that natural balance of our body. So that's what it's doing. And it may even help with some energy metabolism. Some people say they have shed some weight when they've taken CBD. Also, that's helped them with anxiety. And then I didn't go as far as say that I do know people that take it for seizures as well, and helps the brain activity. So this is where it all works, the science behind it.
So
And
if
Alzheimer's.
I'm sorry.
What was that, Annie?
It's shown to, if you start taking it early on, to prevent the plaque from building up that causes Alzheimer's and dementia.
So I think more and more research will be done, coming out on this.
Wow. So if I have a tear in my muscle, I've injured myself in some way, and I take the CBD, it's not going to do anything to heal the injury. It's just going to deal with the pain.
The pain, and if there's inflammation associated with it, it can get down inflammation. But once again, if you have like a tear or a herniation, it may, it's not going to help to heal that. May need some sort of other treatment to help with that.
And that's a good example, David, about listening to your body, where you can, there's a difference in feeling between a chronic pain from overuse or, displacement of a certain joint to, a tear. Right. And how do you tell the difference? One, it feels different, right? And two, diagnostics,
You need to have it checked.
Yeah, and Denise gave us a list of options, CT, X-ray, MRI.
Okay.
And also there are times when you can take these tests and maybe it doesn't show anything at all. So it could be due to the soft tissue, like what Guss does with the fascia. It could be that underlying connective tissue that is very tight, that is inflamed, that is also putting pressure on certain areas. So that's what will help with diagnostics, is to rule in, rule out things.
Okay. Does anyone else have a question you'd like to throw out here? Guss.
Yeah, it's something that both Denise and Annie mentioned was sleep. What impact does CBD have on sleep?
Well, it does relax the system, the endocannabinoid system, the nerves. And if it does, then it's going to help put you and relax the body. So it does help people with their sleep, with the receptors in the brain.
So Annie, you said it helps you with your sleep.
I don't remember saying that, but yes, it does.
Okay,
I take
okay.
it at night before sleep.
Was it you, Denise?
It was Denise
Yes,
that
it
said
helps
it.
me with my sleep. I take it at night, and I really feel pretty good.
Okay, I'm a fan.
Yeah. What it does for me is it reduces the inflammation, because it's an anti-inflammatory. It reduces the inflammation in my gut system, the stomach, my gut, so that I'm not waking up with any stomach ache, which was what was causing me to wake up in the middle of the night.
Mm.
Okay. Well, thank you. Any other questions? Comments?
One, I want to thank Denise for touching this topic, because this CBD is something very important to me monetarily, because I consult with a company that's growing, a company out in Michigan, but because I'm such an advocate for this as an alternative, a healthy alternative to all of the junk they feed veterans.
Mm-hmm.
So Denise, thank you for touching on this.
Yes, and I just think more and more it's going to get very exciting now that they are offering, like say classes for people to go to and to be, certified, and it's really going to help to, those protocols and the answers that people need, rather than just, well, let's go with this or go with that, because it's still in the stages of, take this many, we'll see how you feel, so it'll be a really good thing to standardization of it,
Mm-hmm.
as we see in the upcoming years to come.
Is there regulation coming at some point, or is this kind of like the wild, wild west of CBD and it's just going to stay this
Well,
way?
it's legal in 30 states. It's legal when they have, the medical marijuana. So, it's legal.
All but 5 right now. All but 5 states you can ship CBD to.
Right. All but 5. Yeah.
But there's no regulation as far as who prescribes, how much to take, or,
No.
it's just wide open.
The dosing is self-dosing. You got to figure it out on your own.
Okay.
You can go through certain guidelines, and that's what I did. I bought some books, some literature, so I can read up on it, so I can help, either patients or friends or consulting,
Mhm.
at least get a head start as to what would work the best for them. So there is a learning curve, but I think over time, when we get that standardization, it's going to be much, much better. People will see the effectiveness.
Okay.
Quicker, we hope.
Mm-hmm.
Are there any therapeutic benefits to THC?
Mm-hmm.
Okay, speak up.
Yeah, THC, if you partner THC with CBD, it's incredibly effective for some people. For me, it's not, but other people, the studies have shown that a little bit of THC with a lot of CBD, like 3% THC, is very effective with the CBD. It amplifies the CBD's effects. But then you're paying higher taxes because now it's a dispensary item and not an over-the-counter item that you can get shipped to you.
Okay.
And then what are other dance partners for CBD?
I like saffron. I like things like that would follow natural foods that ancient people have used. So what I'm working with the company right now, we're looking at seeing, can mint and cucumber extract work with CBD, because they're natural anti-inflammatory. So how far down into the holistic grocery line can we go with effectiveness?
Okay, so you're looking at other natural inflammatories like tart cherry, maybe that's a
turmeric.
Natural. Okay. So
and other companies are not looking at those natural foods that people have been taking for thousands of years.
Yeah, interesting. How about pharmaceuticals with CBD? You take an aspirin and CBD.
You wouldn't want to, because aspirin's going to have damage to the organs, where CBD with a food is not going to have any side effect.
Okay, interesting. Okay, well, thank you so much, Denise. For a number of you, this is a familiar subject. For me, this is really the first introduction I've had the CBD. I've heard of it, but that's about it. I've never actually had someone describe it the way you have, Denise. And I thank you, Guss and Annie for chiming in and helping also with your wisdom. Okay, so let's see. Did I? Yeah, I went through the upcoming webinars, and so anyway, yes, definitely go to the Las Vegas Area Trails page, click on Health Education, and click on Register for upcoming webinar, and we'll look forward to seeing everyone next week, Wednesday evenings, 7 to 8.